Alright, so this is my first YouTube video, so I apologize for probably a lot of ahs and ums. Let's see, so it's May 1st, 2019. I'm about to have a XLIF on my L4, L5 at Rush University in Chicago. The procedure is going to be done by Dr. Matthew Coleman. The reason I chose Rush, I've had a bunch of previous surgeries on my low back that have been unsuccessful. This was kind of my last option. My local surgeon in Indiana said there's not much more I can do with you, so I wanted a second opinion. Kind of Googled what the best place in America was for back surgeries, orthopedic surgeries. Found that Rush University in Chicago was number 4. The closest one to my house, so I figured that number 1, number 4 would probably be pretty close. So after reading a bunch of bios and things and watching some documentaries, I chose Dr. Matthew Coleman, and he seems extremely knowledgeable. Looked at my MRI, my x-rays, basically said, here's what's wrong with you. You have a spondylolisthesis over the years from stopping working out because your other back injuries. I think your core and your abs have kind of weakened where it previously held your spine in alignment due to your strength, and now that you don't have that, you're having a lot of movement in your spine, coupled with I had an L5S1 fusion. Now that that's secure, all that pressure's going to L4, L5 where my spondylolisthesis is, and basically he wants to go in there, do an XLIF surgery on it, put 4 screws in, a couple rods to my L5S1 and kind of secure that whole area. He explained everything, broke it down to me, it made sense to me. It was, wanted news because, like I said, I was told that I was done. I was going to have to medically retire from my job. They couldn't find a spot for me because the type of job I had. I was a police officer, and the physical restrictions I had permanently from my first surgeon, due to our policies and things, I wouldn't have the ability to do the job, and they couldn't make an accommodation just due to how restrictive the permanent physical restrictions were. So to kind of give you a background on me, in 2016 I had a discectomy on that low back from an injury I sustained at work. Discectomy went good, did tons of physical therapy, everything was good to go back. I went back to work, and then in 2017 I was chasing someone through some mud, and when I caught him we were wrestling to kind of put him in handcuffs, and that discectomy kind of failed, the disc failed, and I had a huge bulge at that section. So I did everything again. I would say probably 150 physical therapies, 3 sets of injections, everything you could basically do to fix a bulging disc at L5S1, dry needling, you name something, they tried it, and basically none of those worked. It didn't help. I was still extremely limited in what I could do physically, so they said that I would need a L5S1 fusion. So I had that in 2017. It never healed. I mean, it's healed 100% on the, what do they do, the, not CAT scans, whatever scan they do to check your bone healing, and it's healed 100%, but the pain's still there. It's better than it was, but it's nowhere near what I need to do my job. I can't run, I can walk a mile, I can't bend over, I can barely get out of a car, things like that. Probably a lot of similar things that a lot of people are having that are probably watching this video. So, sorry, I'm reading some notes. I wanted to make sure I get everything for you guys. I've had a bunch of surgeries, so I kind of know which ones were the worst, which ones were the best. 2003, I had a discectomy on my C3 in my neck from a football injury I had in college. I had to get my ankle reconstructed in 2013. I've had a bunch of broken bones, legs and arms through my teenage years, so I kind of know what the pain is and what's associated with it. So I know how bad that L5S1 fusion was. I had a terrible time with it. They went in through my back, did a minimally invasive version of it. It's still, I mean, I haven't healed yet. I'm still in pain from it, and that was 2 years ago. I talked to other people that had it, and they were saying, I had 2-3 weeks they were feeling better, and I remember at like 2-3 months I was like, something's wrong. I can't go on living like this is terrible. Eventually got a little bit better, but I would say at about that 9-month mark it kind of staled out, and that's as best as I got. And it's been a year and a half of just being completely miserable. Like I said, my life is completely different from what it was before. I worked out all the time. I was super active. I was pretty fit. Could run 3 miles at a time, no problem. I did a bunch of CrossFit type workouts. Would go hiking on my days off, things like that. So, pretty fit for being in your early 30s, pretty active. And now my life is, it's miserable. I'm in pain right now, just kind of sitting in this chair talking to you guys. I can't ride in a car for more than an hour. I can't usually sit for more than 20 minutes. There's no way I can run. I can't pick up anything over, say, 25 pounds if I have to bend over, to the point that if I drop something, people already know me close. They just get it for me because they know how much trouble it is for me. So my current symptoms from what I have going on, it's pain all the time right at my belt line on my left side. And then days where it gets really bad, so that's like a lazy Sunday. It's kind of like a 3 out of 10 at that belt line, which is manageable. I can walk around, go to the store with my wife, not a big deal. I'm still at work on kind of like restricted desk duty. The days that I have to go to work and I'm up and about, going to the printer, things like that, by the time of the end of the work day, I would say I'm at like a 5 out of 10. And then when I get home, I'm done. I just lay on the couch. And then when I get off the couch, it's hard for me to get off, things like that. And then days where I'm really busy, say like a weekend where I go to the store with my wife and maybe we go out to eat, and just normal everyday living, that shouldn't be an issue. I'm up around like 7 out of 10. And once I sit on the couch, I'm done for the day. As for medications, I didn't want any medications. I didn't want any opiates or anything like that. So really rest and, ibuprofen is what I kind of try and live on. It doesn't help. It may help enough for me to get to sleep and things like that. I sleep fine. Laying down is where I'm at, like almost no pain, but it's anytime I have kind of pressure on that vertical pressure on your spine, any impact, anything like that is really terrible. And like I said, the doctor said just from my low back muscles weakening and my abs weakening, kind of that whole core area, there's a lot of movement in that spine, and that's what's causing all my pain. Additionally, like the actual symptoms, I think maybe I kind of went over this with the belt line, but like on the really bad days, it goes down into my groin, it goes down my leg into behind, it kind of stops right behind my knee. Every once in a while I'll feel it in my feet. And then like the really bad days, it'll actually kind of, for guys, this is terrible, it kind of goes into your testicle, and that's the most uncomfortable, terrible thing. So and then really, really bad days, it'll kind of mock everything on the right hand side, but usually it's mostly to the left. I don't know what else really to go over. Like I said, it's May 1st, 2019. My XLIF on L4, L5 is tomorrow. I'm hoping to kind of update this. The reason I did is I didn't see any great videos that kind of went over the whole timeline from pre-surgery, kind of what they're feeling, to after surgery, that were kind of down to earth and not doctor-backed, or not, someone at a clinic doing it at the request of a doctor. So like I said, I'm going to try and do this tomorrow after the surgery, and if not, then I'll get it when I come home from surgery, and try and do like a post-op surgery update, day 2, day 3, things like that. So sorry if I said and a lot. If you have any questions, feel free to ask. Like I said, I will try and keep this updated pretty good. All right, thank you.